March 12, 1968, a Tuesday morning that began with paperwork and ended with a woman's humanity being stripped away by the very people sworn to protect it. Her name was Helen, though that wasn't her real name, which remained buried in classified hospital archives for 35 years. She was 34 years old, a librarian, a mother of two. She trusted doctors the way most Americans did in 1968, implicitly and without question. By 6 p.m. that evening, she would be moved to a specialized wing with soundproofed walls, and within 72 hours her screams would become so constant, so desperate that 3 nurses would quit rather than witness what was being done to her. But here's what will haunt you. What happened to Helen wasn't a mistake, wasn't a rogue doctor operating in secret, and wasn't even illegal. It was approved, documented, and funded. And the hospital where it happened is still operating today. In 1968, America was caught between the Vietnam War and the Civil Rights Movement. But inside hospitals across the country, another battle was being waged, one where patients had almost no rights at all. This was the era of medical paternalism, where doctors decided what was best for you and you didn't get to question it. The Nuremberg Code existed, yes, created after the horrors of Nazi medical experiments, but it had a loophole you could drive an ambulance through. Medical necessity. If a doctor declared something medically necessary, your consent became a formality, not a requirement. Hospital ethics boards didn't exist. Patient advocates weren't a thing. Your medical records belonged to the hospital, not to you. And into this world walked Helen, believing she was checking in for treatment of a chronic condition. Within 2 hours of her admission, her medical file was flagged with a red sticker. Hospital records declassified in 1994 would later reveal what that red sticker meant. Approved for Protocol 7. Helen had no idea what Protocol 7 was. She was never told, but 3 doctors and a research coordinator had reviewed her case and unanimously agreed she was perfect for what they had planned. The consent form she signed that morning was written in medical Latin and technical jargon so dense that even nurses could decode it. Buried in paragraph 7, subsection C, was a single sentence. Patient agrees to participate in observational studies that may cause temporary discomfort for research purposes. Temporary discomfort. Those 2 words would become the legal shield that protected everyone involved in what was about to happen. By 9 p.m. that Tuesday evening, Dr. Marcus Whitfield, again, not his real name, protected under legal settlements, entered Helen's room with 2 residents and a nurse. He explained they would begin therapeutic treatment at 6 a.m. the following morning. He used phrases like standard protocol and for your benefit. Helen, trusting the system entirely, agreed. What Dr. Whitfield didn't tell her was that Protocol 7 wasn't about treating her condition at all. Her condition was simply the justification for admission. Protocol 7 was designed to answer a single research question that obsessed pain researchers in the 1960s. At what point does the human mind break under sustained physical trauma while remaining conscious? They wanted to map the neurology of suffering. They wanted to document the precise moment when begging turns to silence. And they needed a conscious, undrugged subject who couldn't refuse or escape. At 6:45 a.m. on Wednesday, March 13, 1968, Protocol 7 officially began. Dr. Whitfield started with what he called baseline discomfort assessment. Clinical language for deliberately causing pain and measuring the response. Helen was restrained with industrial-grade straps, the kind used in psychiatric wards, not for her safety but to ensure she couldn't interfere with the experiment. By hour 3, Helen wasn't asking for pain relief anymore. She was begging, and every word, every plea, every desperate cry was recorded on a clipboard under categories. Rational negotiation attempts, emotional appeals, religious invocations, surrender statements. They were cataloging the language of suffering. While Helen begged for mercy, doctors stood there checking boxes, documenting which type of plea she used and when. Because Protocol 7 included a clause that Dr. Whitfield had added personally, pain management will be withheld to prevent data contamination. If this story is making you feel something, if you believe this kind of history needs to be remembered so it can never happen again, hit that subscribe button right now. Because what you're about to hear in the next section is how 3 nurses tried to stop what was happening, how they failed, and how Helen's family sat 30 feet away with no idea their wife and mother was screaming herself, voiceless just beyond those soundproofed walls. By Thursday morning, hour 36, Helen stopped forming coherent sentences. The physician notes described this clinically, subject transitioning from verbal protest to non-lexical vocalizations in plain English. She was screaming, but the screams no longer contained words. On Friday, hour 60, an overnight nurse attempted to administer morphine without authorization. She was caught before she could inject it and fired within 6 hours. Her termination paperwork listed the reason as violation of research protocol integrity. When that nurse was escorted from the building, she passed Helen's family in the waiting room. They asked how their wife and mother was doing. The nurse, bound by confidentiality and terrified of legal action, told them she was responding to treatment. Responding to treatment while 3 doors away, Helen had been screaming for 60 consecutive hours. On Saturday morning, hour 72, a 24-year-old nurse walked into Helen's room and thought there had been a mistake, thought the patient had died and no one had recorded it. Helen wasn't moving. Then the nurse heard a sound not quite human, like wind through broken glass. Helen's eyes were open. She tracked movement. She just couldn't speak anymore. The physician notes from hour 72 read, subject no longer producing lexical content, vocalizations reduced to sustained tones, pain response verification, subject remains conscious per pupil response and vital signs, protocol continues. They knew she was aware. They knew she was still experiencing everything. They just documented that she'd moved beyond language. And Dr. Whitfield seemed excited about it. That's the word the nurse used decades later, when she finally broke her silence. Excited because he'd found the threshold he was looking for, the point where the mind can't form words anymore but consciousness remains. 3 nurses went to the hospital administrator that afternoon. They didn't quit, not yet. They tried to work within the system, filing a complaint alleging unethical treatment of a patient. The administrator thanked them for their concern, explained that Protocol 7 had been approved by appropriate oversight channels, and told them something chilling. Your job is to observe and document, not to question the research objectives. All 3 requested transfers to different departments. All 3 were denied. By day 6, all 3 had resigned, their careers permanently altered, their testimonies buried under confidentiality agreements for 30 years. On day 9, March 21, 1968, at 6 a.m., exactly 192 hours after it began, Protocol 7 officially ended. Not because Helen died, though reports indicate she had begged for death after hour 3, but because they had collected enough data. They finally gave her morphine. Not out of mercy, but because the research phase was over and they needed her alive and stable for the next phase. Observing post-trauma recovery metrics, they kept her 6 more days, documenting how quickly she could regain speech, whether psychological function would return, how permanent the dissociation was. A psychiatric consultant brought in during recovery wrote in his assessment, patient exhibits severe psychological trauma consistent with sustained torture, prognosis for recovery uncertain. Recommendation: extended psychiatric care and legal consultation advised. Helen was discharged on March 27, 1968, 15 days after she walked through those hospital doors. Dr. Whitfield published 14 research papers using her data. He never faced a single criminal charge. The hospital never issued an apology, and Helen's real name wasn't released until 2003, when investigative journalists finally broke the story that 3 nurses had been trying to tell for 35 years. Today, what was done to Helen under Protocol 7 is classified as torture under international law. The consent form you sign at your doctor's office, the patient bill of rights posted in every hospital room, the ethics boards that review every research proposal, they exist because of what happened to Helen and others like her in the shadow of medical paternalism. The hospital where this happened is still operating. You might have driven past it this week, and somewhere in its archives, portions of Protocol 7 remain classified even now in 2025, protected by legal settlements and institutional silence. Helen survived, but the question that should haunt us isn't whether she lived through those 9 days. It's how many others didn't, how many red stickers were placed on how many files, how many screams were muffled by soundproofed walls before we finally decided that a patient's humanity mattered more than a researcher's data. Leave a comment below and tell me, do you think the people involved in Protocol 7 believed they were advancing medicine, or did they know exactly what they were doing? Because that answer might be more terrifying than the experiment itself.